Tim Giddens. I am the Community Outreach Manager at the Norfolk site, BrightView. Welcome. I want to show you around. Take a walk with me. 5357 Henneman Drive. We're right in the Robin Hood section, Industrial Park area. We're right across from Ferguson, around the corner from FedEx. Come on in. One of the things you'll see is the welcome. You are definitely welcome here. We're going to show you the lobby area. Come right on inside. The great thing about BrightView is windows. You're going to be able to see outside. We've got that triage doctor's office feel, but it's warm and inviting. It's something that you can come in and you can get comfortable with. We know that you're possibly going to feel very uncomfortable. This is going to be new, it's going to be challenging, but we don't want you to feel uncomfortable in any way. This is our lobby area. We've got restrooms here, television here. One of the big things is we let you know who BrightView is from the beginning. I really want to emphasize this. This is our values. Rise. Respect, inspiration, service, and excellence. And this is our why. I want to give you a brief statement on that. BrightView was founded in 2015 with a commitment to helping patients access personalized, evidence-based, outpatient addiction treatment programs. Our mission, it's not just a one-man show. It's a group of professionals here that come together to serve, delivering life-changing addiction care in the communities we serve. In this community, in the Norfolk community. Our vision, to make a meaningful impact in addiction treatment outcomes. Come on, follow me. Coffee is always hot. These are the initial windows that you'll come to. Again, it gives a full explanation of what BrightView is all about and why we have a better approach, not in a competition sense, but in a sense of being personable and a commitment to you, a commitment to change. Oh, did I mention that we always have snacks right here when you come into the door, and we have days of the week, group names. We try to break down different subjects and options for you. We have art therapy, anger management, coping skills, seeking safety. We approach it from a holistic standpoint, but there's more. These are the doctor's offices. You can see this is something that I try to live by. Tomorrow is the most important thing in life. It's perfect when it arrives and it puts itself in our hands. It hopes we've learned something from yesterday. The doctor's offices are over here. They're normally always here. There's always on staff. There's ready to help you. Dr. Schmidt's office is this office right here. He is personable, tangible. He is not just someone that's just there just to talk at you. He's there to talk to you. And more importantly, he listens. I'm going to take a little bit of a tour here. I want to introduce you to the team. Every organization, every process should have a great team. Guys, do me a favor, if you will, if you just kind of wave at the camera. This is our team here, but these are the people that will check you in. They'll share with you information. They'll make sure that the insurance information is recorded. If you don't have insurance, they'll discuss Medicaid. If you don't have Medicaid, they'll discuss other programs and other options for you. You're not going to be turned away because you don't have instant information. We're going to work with you. We're going to find a way to make a difference. That's the initial area there. In here, you have the different offices, and you'll see back here where we have our equipment. A lot of these offices are full of professionals, PSRs or care coordinators, people that will take the time to listen and get your story. People that will share with you a focus and a way that you can see a better day. And I know that sounds kind of cliche, but it really makes a difference. We don't just consider you a number or a project. We consider you somebody that needs to be cared with, not just cared for. Take a walk with me. This building, even though it is one story, is long. It goes all the way back. I love to walk down this corridor, and The corridor reminds me of the steps that we take in life. Let me show you the nurses station over this way. The nursing station is where we'll have a number of professionals that will take care of you. I'm not going to take you all the way back there because there's a client back there, but there's a treatment room back there and nursing stations back there. This is an area that you would be interested in. This is a treatment area where you can come and sit, and after you've received some type of treatment or dosage, you can come and you can be evaluated. And also, it's a little more private, so that way you're not sitting in the lobby. And I know a lot of times people are really concerned about having things made readily to any ears. You know, they like to keep their private, and they want everybody knowing their business. And that's why this is a good opportunity to come in here, relax, and catch your breath. Follow me. These are lockers where personnel here will instruct you where to put your things. You get the key, and you're able to put personal items in there while you're receiving treatment and while you're receiving dosage, and everything is secure. These are the restrooms here where you'll be going in for screening. And follow me around this corner. I'll show you another area. This is the bullpen. A lot of times we have different meetings, different sessions in here, different discussions. Right now we have our art supplies in here. Art is a very big thing here. It's a part of the therapy, and I've just moved around some things in here so we can show you the rest of the building. But we have everything from drawings to paintings to washable markers. And again, this is all a part of the therapy. I want to emphasize everything is holistic. Now, oh, don't go anywhere. I've got a friend of mine that is right here. She's going to say, nosy. That's all right. We need you to be nosy. I need you to say hello, introduce yourself, tell everybody what you do.
I'm Davina. I'm the care coordinator here in Norfolk, and the short spiel of what I do is I am the person that makes sure that our patients have everything that they need outside of BrightView to help maintain their recovery. So whether it's they need to find a new doctor, they need help with housing, need help finding a job because they have a record, or they just have a disability that's been keeping them from working. That's what I'm here for.
I love it. Now, I'm going to put you on the spot.
Oh, God.
Why do you do this?
I like helping people. I enjoy seeing the transformation that people go through, like whether it be in substance use or any sort of social services field. So this is just where I've landed in my career.
That's the why. That's the why. Follow me. Thank you so much. We're going to go back to our offices back there, so we got to clean everything up, make sure everything's all tidy. I want to walk you over to the group room. The group room is an exciting place. Right now we've got some equipment in here, but I wanted you to see this. Look at this wall. The question that BrightView wants to ask you is, how are you feeling? I want you to see this wall. You're going to see the different stages, things that you might not be able to express. We've got a drawing for you. It's something that you can point to. It's something that you can relate to. And we care. It's not just, again, checking off a list. Stages of change, whether it's pre-plantational, preparation, action, maintenance, and session rules. This is where we have the group meetings. We listen to one another. One of my mainstays here is be respectful. We are respectful of one another's opinions. We're respectful of one another's beliefs and where we are at the stage of treatment and where we are just even walking into BrightView. Because this might be a point where you've made that step to come in to see what we can offer you or what we can do with you. And we by no means want that disconnect. If for some reason you're not comfortable, if for some reason you need to talk with somebody separately, we'll make the time to do that. But we do encourage you to be in a group session because there's strength in a group. You realize that you're not alone. You're amongst friends and family. Take a walk with me. All right, so there's a couple of other areas I want to show you. This is our lab area here. It's closed right now, but this is also an area where we have labs taken, clean. Everything is very clean, very well lit. This is an office back here. These offices are for the PSRs, for the counselors, for the care coordinators. We're right here and we're tangible. And the great thing is when you're receiving treatment, it's a warm handoff. There's not a thing of where you just wait and you don't know who's going to help you. We communicate with each other and let you know step by step where you're going to be and what your day is going to look like. So there's no surprises, and we try to use your time wisely. We're respectful of what you need to do. Let me show you this office back here. Now, this young lady you gotta meet. I want you to come on in here, introduce yourself, and I want you to tell them what you do and why you do it.
Hello everyone, my name is Brianna Greer. I am a behavioral health therapist as well as the art therapist here at BrightView. So I think he's mentioning art therapy or referring
Yes.
to that. And I host groups as well as individual sessions with those who are interested. Which is art therapy is another way to get people to express here, and so they really enjoy it. So.
All right, it's good. And I gotta ask you, just like I asked Davina, why do you do this?
Because we all need support, right? I think we've all been in situations where it's been difficult to find help, to find resources, and to find people who care, right? And as someone who does care a lot about people and what they're going through, mental health especially in this community, right? We all need someone that we can lean on. So it brings me no better satisfaction than to come here every day and be with a team that helps everyone to get there. Like, it's not just on one person, which I love. It's on everybody playing a role, everybody playing a part. So that's why I do it, you know.
All right, sounds like a plan. Thank you so much.
Thanks, Tim.
I'm going to take you into my office. Now, the key with my office is rarely am I in here. A lot of times I'll check in the morning. I would love to be a part of the morning huddles. The morning huddles is where we strategize and we determine what is our best practices for the day. We get our thought or theme for today, and that's where we really form the team. I'm going to wrap this up. That sign right there, if you can take a look at that, that is in Ghent. That's the Badertoort crossover bridge, and that's what BrightView means to me. It's a bridge. It's areas where you can sit. It's right by the Chrysler Museum. And if I can leave you with anything, I said it before and I'm going to continue to say it. When you're ready, we'll be here.